Liz, can you begin with just an overview of the Dominican Sisters of Hope's Vital Living program?
Sure. Currently, the Vital Living program is made up of myself as the Holistic Health Administrator. I have two community-based registered nurses that work in different geographic areas. One is a sister. I have another sister who is our transitions coordinator that assists us with all of our moves, as well as running errands and providing transportation to sisters that live in a community near her. And then I also have 4, they're not full-time, they all work what hours that I need, 4 other care coordinators in different geographic areas in the area. The Dominican Sisters of Hope currently have about 1/3 of the sisters living in New York, 1/3 in New Jersey, and 1/3 around the rest of the country. And they are in 13 states still at this present time.
So why did you include all the sisters in the program instead of just those currently needing healthcare services?
We initially developed the program to help provide support to our sisters that moved out of our infirmary and mother house into the various assisted living and skilled nursing facilities. But then about 1.5 years after those sisters made that transition, we really started to think, well, what about the other 75% of our sisters that were still living out in the community, you know, either by themselves or in small groups or still in a few convents. And I always like to be proactive and not have to deal with crisis situations all the time. If, you know, of course they still do arise, but our goal was to actually be more proactive and to start engaging these sisters as well. We felt that it was important to do that.
And can you talk a little bit about some of the ways you engage them?
Yes. The most important part was for the sisters to get to know who our team is. And we did that in pretty non-threatening ways. We never, even with the sisters working in facilities, we never wanted to force our assistance and services upon them. And it's the same thing with the sisters living out, you know, independently. So what we did was to make our presence known. I often did presentations at the annual assemblies or at the community chapter meetings. Sometimes I wouldn't be there, but we would do a videotape on, for example, advanced directives, something that would be useful to the sisters, but then also let them know that we're available to them if the time ever arose. We then took it a step further and started doing home evaluations and assessments. We at first asked for a group of sisters that would be willing to pilot this program for us. And then we actually figured out how they would be done. And we started with the sisters that did not have frequent contact with the congregation or with their leadership contact. The ones that we really didn't know that much about and didn't know, you know, how they were living, were they still safe where they were. So that was really our next step. And through those evaluations, we not only got a baseline, you know, of how the sister was doing, not just medically, but also, you know, physically, spiritually. That's very important that we really encompass the whole person when we work with the sisters. So through those assessments, besides the baselines, we were able to identify right away things that might be helpful to her to be able to stay in her home as long as possible. For example, just off the top of my head, the thing we did most was to put in medical alert systems for those sisters that were willing to use them, especially if they were living alone. We did bathroom adaptations, you know, higher toilet seats, bars in the showers. So simple things like that could make it safer for someone to live, you know, in their home longer independently. So we did that. We then incorporated a newsletter, and each month that goes out. One of our sisters assists me with that, which is wonderful. And we always include an article on, it's all about wellness usually. So we'll do it on physical wellness, psychological wellness, and spiritual wellness. And then I usually put a note in there, you know, for myself and team as well. And the articles, we get tons of feedback on that, you know, and it could be simple as diabetes prevention or eating healthy or exercise, the benefits of that, you know, just a few things as an example. The biggest part is forming relationships with these sisters. So, you know, I think being present, especially as a layperson and team members coming in, the sisters don't know us in the beginning. So it's very important for there to be opportunities for the sisters to get to know the team, you know, prior to when they might need them in the future.
So I'm sorry, go on.
No, I was going to say our last initiative that we started last year was to reach out to the sisters that live in the outlying states as far as Puerto Rico, Florida, Virginia, West Virginia. So we have them scattered and they're getting older as well. Most of them are not working full-time in ministry, but they're still in the area volunteering or, you know, working part-time. And we sent out post-retirement living forms for them to really start thinking about, okay, am I going to stay where I am or am I going to come back home to New York, you know, and be with my sisters? And, you know, if they're going to decide to stay where they are and they have adequate supports, that's fine, but we want to know that ahead of time so that, you know, we don't get an emergency call one day and says, oh, sister's, you know, not in good shape and she needs to move back to New York. So again, just another way for us to be more proactive and to really get the sisters to start thinking about their future.
And Liz, what are some of the outcomes that you've seen? You've been at this for over 8 years.
Yes. Yes. Well, our sisters definitely have stayed in their apartments or in their living situations for probably a longer period of time than they would have without this program. And probably because they would have ended up with a medical condition, you know, a hospitalization and then so forth, and not be able to return to the community, or they might not have been able to access supports in the community. I mean, even simple shopping, errands, transportation, someone to check in on them. Like, we provide all of that, and I certainly believe that the sisters have stayed longer in their homes because of those services and linkage to services. Sometimes they stay longer than we still would like them to stay, but we know they're safe and we're able to check in on them, and they've been very willing to allow us to do that. The other outcome is when a sister is ready to transition, 90% of the time the decision is hers and has been hers, because we've been having ongoing conversations, you know, with her about when the time would be right. And that's the best way, obviously. You know, the moves are more successful, the sisters are happier. We really have time for them to visit different facilities, you know, in different living situations, so that she can make the best informed decision for herself. So, you know, that's definitely been a positive outcome for us. And then the other piece is previously, if a sister, you know, ended up having a surgery or ended up with a medical condition, she would either handle it herself or call on, you know, one of the other sisters to assist her or a family member. But now the sisters truly are comfortable with contacting us or a member of our team to assist during that time. And it might just be for the time, you know, that she needs help with this medical condition. And then, you know, we go on to someone else and so forth. But it's nice that I would say the majority of the sisters really feel comfortable in doing that now.